Everybody experiences some discomfort in new or unfamiliar social situations. Social anxiety involves severe feelings of distress, embarrassment, or apprehension and a tendency to withdraw or avoid the situation. This can have a significant impact and often places limits on the individual's work and personal life. Social anxiety is usually rooted in a fear of being negatively judged by other people. This can include feeling exposed, inadequate, incompetent, stupid, or offensive to others. This can lead to worries about being embarrassed or humiliated, blushing or looking nervous, shaking and feeling breathless, stomach problems or bladder urgency and feeling disoriented, overwhelmed or detached. Social anxiety affects men and women of all ages and often starts with shyness and social avoidance in childhood or adolescence. Social anxiety is a highly debilitating problem affecting up to 10% of the population and is often linked to other psychological problems including generalized anxiety disorder, body dysmorphic disorder, low self-esteem and depression. The social anxiety cycle can be triggered in the following situations: being introduced to new people or talking to strangers, making eye contact or casual small talk, being placed in the spotlight, speaking in public or delivering a presentation, being watched or scrutinized whilst performing a task, eating in public places, having to walk into a busy room, group meeting or party, preparing for unfamiliar social encounters or large social events, introducing oneself in a circle or meeting at work, forming new interpersonal relationships or dating. How CBT is used to treat social anxiety. CBT has been shown to significantly reduce the impacts of social anxiety. Clients learn a range of cognitive and behavioral techniques to realistically evaluate their anxiety, develop improved personal resilience and shift their focus of attention back to fully engaging in the social or performance situation. CBT for social anxiety usually involves work in 5 key areas covering cognitive change, behavioral exposure, behavioral experiments, focus of attention training and social skills practice. Each of these areas are briefly outlined below. Cognitive change involves identifying and altering the negative thoughts that maintain distress in the 3 stages of preparing for a social situation, engaging in the social situation and evaluating the social situation after the situation is over. Clients are taught to catch, check, change or let go of negative thoughts that cause distress or interfere with social performance. Focus of attention training involves learning how to shift focus from uncomfortable internal feelings to the social task or activity. This involves learning how to normalize bodily sensations and fully concentrate on the task in hand. Graded exposure involves planning and undertaking activities that are normally avoided. The client is encouraged to take small steps to normalize their anxiety without feeling overwhelmed or out of control. Behavioral experiments are exercises in which beliefs about performance in social situations are predicted, tried out and evaluated. The client and therapist work together to test negative assumptions and strengthen coping beliefs. Social skills practice involves working in the room with the therapist to try out different scenarios and practice interactions in a safe and non-judgmental environment. Sometimes the therapist may suggest that the exercise is recorded or videoed to help with feedback and evaluation. Depending on the needs of the client, the cognitive behavioral therapist may also incorporate other CBT techniques including mindfulness skills, cognitive diffusion, acceptance exercises and visualization work to support the process. Cognitive behavioral therapy for social anxiety brings the same rigor, structure and focus to the problem that it provides for many other psychological, emotional and behavioral problems.